Hello, my name's Jack. I'm here with Lisa Pont, who's one of the SHPA Federal Councillors, brand new, and we're here at Medicines Management 2015. Lisa's presenting in the next couple of days, and Lisa, would you like to tell us what you have to offer?
Thanks, Jack. I've got a number of presentations, but one of the ones that I'm most excited about is looking at how medicine use changes towards the end of life. So we're really looking at what happens in that last 12 months. Do some of the medicines that we hope would get stopped? And do some of the medicines that we hope would get started, do they actually get started? So are we seeing people are getting appropriate pain relief and symptom relief when they're likely to need it the most?
So very much a geriatric bent.
Very much a geriatric bent. I think I've spent most of my hospital pharmacy career working in geriatrics. I spent the first year in paediatrics and the rest of the career in geriatrics. So it was from one end to the other. But mostly now I work in aged care, residential aged care, and I work with a number of organisations across New South Wales to look at how we can improve the medicine use across their facilities.
Would you like to name drop?
I can name drop. I do a lot of work with Webster Care, who supply a number of facilities and who are a great partner in the research I do. I also work with Uniting Care, Southern Cross Care, and I'm about to start a really exciting project with Catholic Care next year. We've got government funding to go ahead and do a randomised controlled trial in 39 of their facilities.
A lot of things on the conference in the next couple of days. Have you got any standout things that you want to make sure you get to?
I'm really excited about going to the de-prescribing workshop. I think that's got a great overview of how we can think about medicines in older people, and I've actually just snuck out of it. And I think one of the biggest things I'll take away is, as pharmacists, we often think about leaving things the same if we're not certain what to do. And just before I snuck down here, one of the pharmacists challenged us to think about not leaving things the same, and that leaving things the same is actually a deliberate act. And would we start a medicine in that person? Well, leaving things the same is just the same decision making. And I think that's something that I'd like to take away from this conference, because I do think sometimes we take the easy way out and we just leave things the same.
So in terms of the research that you do, which is a large part of the work that you do now, what are some of the end game goals that you're trying to achieve?
Really, when you're working in aged care, the end game goal is to help people feel better and make sure that people are getting the best quality of life. And medicines can have such a big impact on somebody's quality of life. So really optimising medication therapy, making sure people get the right medicines, making sure they don't get the wrong medicines, and in general helping them to get the best medication care that we can. So really looking at quality and safety of medication management.
Terrific. Well, I hope you enjoy your conference, and
thank you.
We'll see you at your presentations.
Thank you.
Plural.
Thank you.
Thank you.